I'm Dr. Lisa Wilcox, and welcome to your self-care tutorial for the very initial way that I like people to engage their gluteus medius. So the gluteus medius is a muscle. So you've probably heard of the gluteus maximus, the big, huge glute muscle right here. But the gluteus medius is up here a little bit more towards the top of your pelvis and to the side. And it is so important for so many things. So if you've got, really I could list off pretty much any kind of pain and your gluteus medius might be involved. So this is super duper important. I'm going to show you how to activate it in a really safe and gentle way. So what you're going to do is lay down and you're going to bend one knee. I'm going to show you this side so you can see it a little bit better. Bend one knee and keep the other one straight. So you don't want your foot way out here. You want it bent comfortably. So if you can't get it this close, that's okay. Just bring it to wherever you can. But I want it to be somewhat closer to your body. Again, not way out here, because then it's going to be really hard to activate your glute med and you're going to be getting a lot more of your hamstring. So have your knee bent about this angle. And then what you're going to do is, I like people to feel it because that helps your brain connect to the muscle and it helps everything kind of figure out, oh, that's what I'm trying to work. So the gluteus medius is, if you can feel your pelvic bone, like put your hand into your waist and push down until you hit that bone, that's your pelvic bone. The gluteus medius is back a little bit, so not all the way towards your spine. It's about, you could feel it halfway between kind of your hip and where the center, where your spine would be coming down into your sacrum, and go over about halfway there. And so what you're going to do is you're going to have your fingers here, and then you're going to push up this hip off the ground. Now my other hip is staying on the ground. We're not doing a single leg bridge. This is just pushing up this bent knee side, and you're going to push up, and it's going to rotate your pelvis over a little bit. But again, we're not going like way over like that. It's a very small motion. So you're pushing up and then coming back down. Now when you do that push up, you should feel a muscle contracting under your fingers here. If you don't, try to really think about squeezing your glutes. Now again, you can totally squeeze your gluteus maximus, the big one. That's going to kick in no matter what. But think about squeezing that, and think about squeezing your glutes really a lot, really hard as you lift this hip up off the ground, and hopefully you can feel that little hardening or contraction of your gluteus medius. Now, this exercise is pretty gentle, but if you're having any pain, just don't go that high. Or move your foot around a little bit, see what works best for you. And again, if you feel like you're like going way over like that, that's way too much. We're just going for this initial lift. So think about those glutes squeezing and then control back down. Squeeze and control back down. Now this exercise, you might start to feel a little bit of a burn in your glute. If you don't, do not worry. It's a pretty simple exercise. We're using this to get that muscle to learn how to turn back on. So if you feel a little bit of a burn in there, awesome. That means you're getting that muscle starting to turn on and work, and it's getting a little fatigued. But as far as sets and reps go, I usually start with like 3 sets of 5 repetitions. If that's too much, do less. But then I usually like people to work up to about 3 sets of 20 repetitions before we progress on to the next exercise. So again, this is the exercise. Please do it on both sides. If you have a side that works better than the other, sometimes it's actually really a lot better to start with that side, because your body will go, oh, that's how that's supposed to feel. And your brain will go, oh yeah, I think I can do that on the other side. So just remember, it doesn't necessarily matter, but I personally feel like it's better if you start on the good side so that your body can figure it out, and then go to the side that's not working as well and hopefully it will start to learn how to kick back in. Hello!